guys, welcome back to my channel. My name is Kanita and I'm here just to share with you a health scare that I had recently. We all know that we're into a global COVID, dealing with that, and I just find that we're not really taking care of ourselves per se, like how we usually or normally, because we are not going to doctors as frequent, and we basically like stay away from the doctors, right? Who know about that? I'm sure I'm not the only one, but I was. Over the year, I really was staying away from my doctor. But nevertheless, last year I actually went and saw my family doctor, and I told her about how I was feeling. I know that I was a bit more fatigued, and I would start having headaches, which I normally don't have headaches, but I started to check my blood pressure at work, and I find that my blood pressure was a little bit high. And I said, no, this is just not me. So I decided that I needed to talk to her and go in to see her to, maybe get some tests done to see what's going on. So she did have me come in, and I went in and she said, you know what, she's gonna do a total physical. And I said, okay. And I was happy for that because, last year, that was like a lot of doctors are not taking in people. So she's saying she will do a physical. I was like, oh, fantastic. So I did do my blood works and, did my physical and everything. And she said, well, if there's anything, obviously she'll give me a call. I said, no problem. So I went on my merry way and everything. Months later, like for example, actually this year, earlier this year, give and take about February, I start getting those headaches back again. And I'm like, I really gotta go in and see the doctor, because you know what? I felt like really drained. When I said drained, I have like a 4 weeks vacation for work, never took one day. Like I was just working continuously. Some weekends I didn't even get my weekends, but I didn't make it bother me. I just do what I gotta do. I said, once God gives me the strength, I just do it. I just go to work. So I called the office, and they basically gave me a hard time just to make the appointment. And I had to really speak to the secretary, and I said, wait a minute, are you guys taking people in? Because why is it so difficult for me to come in and just to see the doctor? And they're giving me, the whole 9 yards, that they're only taking one patient hour, and you have to be screened and all these things. I said, no problem. I'll go through the process, whatever it takes to come in. And she's like, asking me the normal question, if I've ever been out of the country, the whole thing. And I'm like, no to everything. Have you taken the COVID vaccination? I'm like, yes. And she's like, oh, really? I said, yeah, actually I got mine at the beginning of the year in January. So it's like been over a month, going on 2 months already taken my vaccination. I said, what about you guys? And she's like, no. So I said, well, come on now. If anyone's supposed to be scared, I'm the one who's supposed to be scared of you guys. I said, are you guys doing a test every week? And she's like, well, no. And I'm like saying, well, I have to get a test done every week. So I said, look, if I know I have it, I will not come in. And I said to her, the receptionist, I told her, don't worry, like I'll make sure I wear my mask. I don't have a problem wearing a face shield. I'll even wear a gloves. Like I'll take it to whatever measure you want. You want me to wear my full PPE? I'll do that too. You know what I mean? So she's like, oh, don't worry about it. Just come on in and everything. So I got the appointment book, and I, went in to see my family doctor. I was like, okay, yes. So I showed my doctor all the blood pressure readings that I have been documenting and the time, and everything, because sometimes I'm taking it in the mornings, early mornings. I take it midday, sometimes in the evening, just to see the difference, right? And I just see that slight up on my, the slight number is up. So I said, I don't want to be having high blood pressure and not aware of it, right? So then I showed her all these, and she said to me, "Oh, that's nothing. That's pretty low." And I'm like, "Oh," I said, "Are you sure?" Because I said, with my family, we are rampant in with high blood pressure and diabetes, so I just want to be on top of things, so nothing just doesn't come on me as a shocker, right? And then she looked at me, and she's there flipping through my file, and then she looked at me and she said to me, "Oh, by the way, your glucose level is a bit up." I said, "My glucose level?" And she's like, "Yeah." And she's like, "You need to, reduce your sugar intakes and all that." And I'm like, "Oh." I said, "How you know that?" Because I said, "Is it from last year?" And then she said to me, "Yes, I see the result here, and it's a little bit high." And I said, "What do you mean by high? Like how high?" And she's like, "Well, you're at the borderline." And I'm like, "What?" I'm like, "Why wouldn't you call me and let me know?" And she's like, "Oh, it's not like a big deal." And I'm like, "Oh, it's not a big deal for you, but that's a big deal for me." Because I said, "Yeah, like my mom, she is diabetic. Like my whole family on my mom's side is basically diabetic." So I said, that's something that I would want to know. So if I need to curb my intakes with sugar, my, salt, whatever it is, I want to able to can do that, because it's not something that I just want. If I get it, I get it. I understand. But if I could do something to not having that be now into my life, I have to take care of and maintain, I want to do that also. So she's like, "Oh, it's not a big deal." And I'm like, "Oh, don't say that. Don't say it's not a big deal. It is a big deal for me." And she's like, "Well, she's going to have me do some more tests, and I could come back to her office." So I'm like, "Okay." And, our meeting was done. And I walked out the office onto the street, and I was just walking into my car, and I was like, my eyes just start gathering water, and I wanted to cry. And I'm like saying, "No, no, no, don't cry, don't cry. This is not it. It's not it. Just don't cry." And I'm like saying, "She's my doctor. I have my doctor for the past 24 years." And I feel like something like that was very important for her to at least could call me or email me, just inform me that this is what was the result of your blood works. It was like nothing for her. So, I went home, I told my family and everything. And right away, I just started feeling, so what is the purpose of my family doctor when she's not being transparent, especially within my health? It was like not a big deal. And I'm like wondering, is that how she behaved with most of her patients? Like, it's not nice. Like, I'm bothered. I'm actually bothered about it, I just don't find things like that is nice. So, I decided that I want to start looking for another family doctor. But you know what? Right now it's like I'm just trying to eat right and making sure that I'm taking in less sodium into my diet, and also trying to get as much rest as possible, and try to exercise and take care of myself, because if I don't take care of myself, who is going to, right? So guys, if you would like to hear more, please, I'm asking to make a comment. Don't forget to share, like, and subscribe to my channel. I am going to definitely give you guys an update, because I'm looking forward for the results. So you'll be seeing a part 2 to this, because I want to share with you guys the result. Okay, so you guys have a wonderful day. Bye.